sessions. I'll just do the usual reminders. Everyone's already starting, but please go ahead and chat your name and your practice name into the chat feature. This just helps us record attendance. And then our contact information is listed here. If anyone has any tech issues or general comments, questions, feel free to reach out to us. And we have a pretty packed agenda, so I'm going to go ahead and just hand it off to Dr. Rao.
Thank you, Jesse. Thanks to everyone. So as Jesse said, we have a very full agenda today. Dr. Przinski and I are going to give a brief didactic session about food policy, and then we've got two great cases from Drs. Frederickson and Laura Marzan. Chris and Jim will be our discussants this morning. I also want to point out that we have a number of guests on this session today who are planning to launch an ECHO program of their own of a very different topic and are here as observers. So next slide, please, Rick. So you're already familiar with the structure of the clinics. Next slide. In terms of disclosures, I have to say that I will reference Groupe Danone, which of course is the maker of yogurt, briefly during one slide. Certainly no promotion whatsoever, no research connection in the context that I'll be discussing it, but I will be discussing it today. Next slide. Another reminder about patient-centered language, and you can read this over at your leisure. Next slide. And I think we are ready. Adam, please take it away.
Great. Well, I'm really excited to be able to talk with everybody today about public policy and health and nutrition. Certainly, it's a topic that I think we could probably, between Dr. Rao and I, we could present 400 slides. So compressing it into a brief didactic was a challenge, but I think we assembled, some important highlights. And I think, this is a little different than a lot of our didactics just because it's policy focused. And so while relevant to the activities of your patients in the clinic, we're talking about things that happen at a much bigger scale oftentimes. Next slide, please. So our objectives are to look a little bit at some regional, state, and national policies around healthy eating, talk about how some of those policies have worked to promote healthy eating, and then discuss some of the challenges and barriers to developing policy and promoting healthy nutrition. Next slide, please. So this is a screen grab of Dr. Bob Binstock, former university professor at Case Western. And Bob used to say, so Bob was instrumental in the passage of the Older Americans Act. And so he knew quite a bit about passing good public policy. And one of the things he used to say is that creating good policies themselves is not really a problem. It's actually fairly easy to write good public policy and come up with it. The problem is to create policies that can actually be passed by politicians and successfully implemented. And that is a much, much harder task. Next slide, please. And so that's a nice lead into this slide, which is from a group, I think, at Oxford that has been at the Nuffield Population Health Group that's been working very hard to understand on a global scale the influence of public policy at the federal level in reducing calorie consumption. And so here they did a study that examined what would happen if they increase the price of high sugar snacks by 20%. So a relatively large increase, like a large tax on the or a large shift in the pricing of high sugar snacks. And what they found is that people of all body mass and all income levels would reduce their energy consumption. And it would cut the prevalence of obesity in the United Kingdom by almost 3% in just 1 year. One of the more notable things is if you compare the yellow bars to the purple bars in this chart, what they found is that a food policy targeting high sugar snacks would be in many cases 10 times as effective as a food policy targeting sugar sweetened beverages. This policy has not actually been put in place. But the other note I just wanted to make quickly about this slide is that these types of studies have been shown to have a tremendous influence on industry decision-making and behavior, even if only simulated studies. So this was a simulation, it was a modeling study. And the reason is they ratchet up the political pressure and they on both politicians and industry gets the message like, look, these policies might be coming, so you might want to think about the sugar content of your products. And what we've seen in the UK and in other places is when these studies come out and when they get a lot of press, that industry does actually begin in some cases to reduce the sugar content of foods. Particularly in the UK, we saw this around sugar sweetened beverages. Next slide, please. So now I'm going to shift back over here to the United States. So the largest, one way of thinking about measuring public policy on food is like, well, where does all of our money go? And what do we vote on all the time in the United States? And so, really the largest financial bill is probably the Farm Bill. It's passed over and over again by the United States Congress and reauthorized by the president. And here what we see is the vast majority of Farm Bill spending is actually on SNAP, so supplemental food assistance for families who do not have enough money to pay for food. So if anybody tells you that we're not doing anything in food policy, that they're wrong. Like we pass food policy all the time in the United States. And a very, very large share of that money is spent to provide food and nutrition to families who cannot afford it themselves. Next slide, please. The other group that sort of ironically seems like it's a big food policy organization is the Food and Drug Administration. However, the scope of their activity is relatively limited. It was expanded slightly in 2016 when they were granted some additional leverage around food labels and what they're permitted to do in terms of sanctioning and regulating food labeling. That 2016 law is actually quite important. They also, as we all know, monitor food safety. Next slide, please. The program that often sort of flies under the radar because it's not part of the Farm Bill is, and most folks sort of conflate this just with WIC, but it's actually the Child Nutrition Reauthorization. And so this is, in many ways a critical nutrition policy in the United States. It includes the National School Lunch Program, which feeds 30 million children per year, including my own children. My children go to public school in a district that decided that because of the potential stigma around some children receiving subsidized or no cost free lunches in school, that all children would receive free lunches in school. This program authorizes the school breakfast program for selected districts and for places where there's very high need, the summer food service program, where children, when they come home for the summer, should still be able to eat so they can go and have lunch either in school or have lunches delivered to their homes from the school during the summer. And it also includes WIC. Next slide, please. So in that context of policy, what we also know a lot there, and I think some folks have talked a little bit about food desert, and it's just a little bit important to have a grasp of what some of those concepts mean, and maybe a closely aligned concept of that. Here it's called the Retail Food Environment Index. A simpler way of expressing this is the food swamp score, which is just the idea. It's a simple ratio where in the numerator we have bad food outlets, and in the denominator we have good food outlets. Next slide, please. So what you can see in Ohio is we have tons of areas marked here in red where this score is like actually terrible. What we see is that, and marked in red are the places where there was actually nothing in the denominator, right? So you can't divide by 0. So it makes it, you can't actually compute the value because you can't divide by 0. So those are the areas in Ohio where we have no healthy food outlets. They might also be considered a food desert, but they are also overwhelmed by unhealthy food outlets. And next slide, please. So this structure seems to be a little bit important for health. This is one older paper that looked at the linkage between obesity, diabetes, and this particular measure. And what we find is that in areas, so on the far right, the darker blue bar there, in areas that are characterized by a modified food retail index of 5 and above. So what that means, there's 5 unhealthy food outlets for every 1 healthy food outlet in a 1-mile area. In cities, they reduce that to a 0.5-mile area. So it's a very high density food swamp. What we see is a much higher rate of diabetes. And so, but I think that, that's maybe a little misleading because people make their food choices not only based upon food availability. And I think Goutham's going to share with us some details about more closely tied to food choices and food policy. Next slide, please. So in that context, what I would like to say is that we can improve. So efforts to improve healthy food availability are generally associated with small improvements. So we see this in food pharmacy programs in clinics across Ohio have had some success. We see this in programs that have worked hard to expand SNAP benefits to include farmers markets, where folks can have many more healthy food options at farmers markets than in some of these other areas. So giving people the sort of power to choose healthy foods does have some small benefit. But really one of the key things we've learned is we need to have a better understanding of food activity environments, like not just where somebody lives, but where they go to consume food and what types of food they consume under what conditions. And policies tend to be a little bit blunt, like most of the ones that I talked about haven't really, taken that activity focus, with maybe the exception of the school-based work. Next slide, please. And here I'm going to hand it over to Goutham.
Thank you, Adam. So I think Adam did such a great job with an overview. I'm going to do 2 things. First of all, put food policy in the context of other approaches to changing or improving people's diets. And then I'm going to talk about my own personal experiences in trying to promote food policy. And just for context, everybody comes to the same place. If you're passionate about preventing cardiovascular disease, you say, well, I've got to start with young people and children because it doesn't make sense to screen someone for cholesterol at age 50, for example, if they've already had damage. And then you say, well, how do I prevent the cardiovascular risks that cause heart disease? I've got to treat obesity or prevent obesity. And then you say, well, I can try to do that 1 patient at a time, which is very, very labor intensive, or I can be an advocate for better policy that will have a population level effect, a major public health impact. So looking at food, what we eat and what determines it. And it is very complicated. So Dari Mozaffarian at Tufts talks about, first of all, the individual, which is the most important thing, socio-cultural aspects of it. In some cultures, you're supposed to clean up your plate, right? You've always heard that quite often. The community environment, of course, agriculture industry, government, and of course, the global environment, just turning out to be quite important lately. So let's look at government and policies and what they can influence in terms of people's diets. Next slide, Ray. So I got interested in this because of, a little bit of frustration. And I'd like to look back in historical context at what people are eating over the course of many lives. And I got to work with an African-American medical student who was doing his project with me. And he was studying the historical context of cooking and catering in African-American communities from the end of the Civil War right until the 1950s. very few people know it, but the largest catering companies in Philadelphia, which is where he was from, were African American. They were owned by African Americans, and it was quite common for, you'd walk into a hotel and the chef would be African American back in the early 20th century, and a lot of the cooking skills were handed down from mothers to sons and daughters over the course of generations, and included traditional ingredients. Well, beginning in the late 60s, a lot of food companies kind of realized that, hey, they needed to expand their markets. And when I was a kid, and I'm guessing that when Adam and a few others were children, going to McDonald's was a special treat. It was not something you went to twice a day, or in some cases 5 to 7 times a week of fast food. It was something you went to maybe once a month at most. But they started to market these foods differently into different groups. So this is an ad from the early 70s. And it does make me angry sometimes that this was a conscious attempt to market to certain communities. And this was at a time in the early 70s when the overall rate of obesity among African American adults was 12 to 14%. Of course, it's 3 to 4 times that right now. Next slide. So I've tried and tried and tried over about 20 years or so. Adam mentioned at the outset, it is very difficult to get food policy passed. It's very easy to come up with policy. So there's 2 routes to it. One is you can appeal directly to government. The other one is, a more successful one, is actually to appeal to private industry. Those people have children, they have families as well, they eat, of course, and they have to think about this. So one of my first attempts was to develop advertising guidelines for television programs that target children. This is pretty horrendous. When I was a kid, you watched Saturday morning cartoons. They would advertise a cereal. The cereal would come with a toy. Many of you are too young to remember this phenomenon, but and then you wanted that cereal, definitely. And the toy would always be disappointing. But in any case, I worked with a network called Cubo, which is now bankrupt, but was owned by NBC and advertised exclusively to children. And together with Cubo's team, their corporate team, we actually developed some standards as to what could be advertised to children. What did the nutritional content have to be? And really, it came down to just a few advertisers. And to their credit, they adopted this policy. So there was no McDonald's, there were no there was nothing that had a high sugar content. So only healthy foods could be advertised. And it actually inspired some of the other companies to come on board. So Cubo took this to this hearing in 2009 and presented this as a sample policy that perhaps the FCC, Federal Communications Commission, could adopt for all broadcasters. As you can imagine, it didn't go anywhere from that point on, but that was an attempt, and it was kind of understanding what the barriers were. Next slide. Another attempt that I made was, and this is Adam talked about beverage taxes. This is when I was in Chicago. This was really tough. First of all, we tried to pass a beverage tax in the city of Chicago, which they were not terribly interested in doing. And of course, they made the very potent point that you could just cross the border into a neighboring community and buy soda for less money, which would mean that retailers in the city would lose money. So it had to be statewide. So we introduced something called the HEAL Act, the Healthy Eating and Active Living Act. And there were 3 conditions we put forth for any beverage tax. First, it has to apply to all caloric beverages. It's not fair to tax Coca-Cola and their pop, whereas Coca-Cola owns other brands, Fruit Punch or whatever, and to say, oh no, this is healthier. That's really not fair. If you're trying to tax sugar, you should tax sugar. The second criteria was this tax has to be significant enough to have an impact upon people's consumption. So Adam talked about a 20% increase in junk food. A 1 cent increase per bottle, for example, is not going to change consumption. We know that. The third and the most important criteria that I insisted on is the money that is raised has to be used for health promotion. Many of you are familiar with the tobacco company settlements from the 80s and 90s. That money, billions of dollars, is used for all kinds of things that have nothing to do with health promotion, roads, schools, etc. Not that those are not worthy aims, but if you don't see the benefit of the tax, you're not going to find that the public is supportive. So we put together a list of things. Some of them are, questionable: playgrounds, improving playgrounds, but some of them are improving recreational spaces, subsidizing fruits and vegetables, etc. This was not passed under the administration at the time, but it was a good experience, I think, for me in what the potential was. Next slide. This is another failed attempt, unfortunately. So some of you know that there's two types of foods in schools, and incidentally, Adam's and my children actually go to the same school district. But there's two types of foods in schools. There's the USDA approved lunch, which must meet nutrition standards and that are set by the United States Department of Agriculture. But schools are free to sell other things on the side for the most part, and they do because they can raise revenue. And I've always argued, if your school is relying on selling unhealthy items to raise revenue, there's something wrong with how your school district is financed. But nevertheless, school districts that are, strapped for cash will sell chips and burgers and things that are higher in fat, calories, sugar, and salt. And so back in 2013, 2014, Michelle Obama, of course, launched the Let's Move initiative. And the Let's Move initiative included a number of components that most of the public was not aware of. But one was an effort to regulate what they called competitive foods. In other words, any food that was sold in schools had to meet some nutrition standards. And I testified give a briefing in Congress in 2014. It was interesting, but it was very much preaching to the choir. The only people that showed up were people who were already on board with this, which was a very small minority of Congress people, and it did not get out of committee at that point. Next slide. So what are the lessons that I've learned from some personal experiences? First of all, doing these things takes an enormous amount of time. Some people do this stuff full time. So if you're a practicing physician and you have other things to do, very, very difficult to have an impact. I mean, you have to be very quick about it. One thing I've learned, and Adam was hinting at, is it's probably best to work with industry and to advocate for better policies through industry. And industry is actually ahead of public policy in many cases. So some of you may know that cornflakes, the amount of sugar in cornflakes is it goes down slightly every year or two. But as Adam said, in the UK, they are far ahead of us in this regard. And it's kind of sad that Kellogg is an American company based in Michigan, but their most progressive policies are in the United Kingdom, where it's much easier to get some of these passed. And so they cut sugar and salt across Europe and the UK. The process is a trial and error. So they've reduced 20% of salt, 10% of sugars. And Kellogg is not unique. Other food companies in Europe are doing pretty much the same thing. So it is the classic behavior change nudge. If you reduce the amount of sugar in Rice Krispies by half, I guarantee it, kids are not going to eat it, and mom or dad are going to buy something else next week, and Kellogg will lose millions of dollars overnight. So you cannot do that per se. So it has to be very, very gradual, and it has to be in cooperation with industry. Next slide. So this is my friend, Thierry Saint-Denis, who is the chief research scientist and now vice president of Goutham Rao. And I've actually discussed these things with him and observed some of his work. Danone is a B Corp, which means it has a strong social responsibility focus. The only other B Corp that you are probably familiar with in the United States is Patagonia, which makes clothing and uses sustainable methods, etc. So it was fascinating to speak to Thierry about Danimals, which is their child yogurt product. And what he tries to do is reduce the amount of sugar and play with some of the other ingredients in a way that children will still eat it. So you can imagine it's kind of a fun thing to do, bring all these 5-6-year-olds in there and have them try it. But the most interesting thing he told me is if you go below a certain level of sugar, not a single child will eat any of it. We're talking about boys, girls, across cultural groups, etc. They won't touch it at all. So he goes, the trick is to be slightly above that threshold. And this is what he does all day, is modifies taste in ways that are creative. And it's an example of how industry can kind of lead the way. Next slide. And that is the extent of our discussion. We'd welcome any questions before we go on to our two great cases today. Any questions?
Goutham, I just have one additional thought. You know, so here in Northeast Ohio, in Cuyahoga County, we've had for, I think, more than 20 years now, a beverage and tobacco tax, a sin tax, that's fairly substantial at the county level. And that tax actually violates every one of those principles that you mentioned for what good sort of health policy like food taxes are, right? It's not significant enough to change people's behavior. It's unfair to certain types of products, and the money goes to essentially a county slush fund that's been used to renovate sports stadiums most of the time. So it's sort of like so it's the inverse of what good policy is. And it's also raised, you know, literally like billions of dollars over 20 years.
Yeah, thanks, Em. So I think it's 38 states that have similar taxes. And in doing this work, we did not count those. And that was the first defense that goes, well, we already have it. We already tax pop, or we already tax cigarettes. And so this has to be presented as a fresh and new perspective. And, you know, not to get into the weeds here, but the city of Berkeley did this with kind of mixed results. Philadelphia did not get through this. They were lobbied against very, very vigorously by the American Beverage Association. So there's been some modest success, but you're absolutely right. The taxes that are in place do nothing to improve people's health, I would say. A couple of points. Chris actually made this really interesting point that once trans fat was removed from products, as most of you know, it was replaced by other types, well, non-trans saturated fat, sugar, and calories, unfortunately. Is there a lobbying group for sugar like the Salt Institute? I didn't know about the Salt Institute, Jackson. That's pretty horrifying that they're promoting the consumption of salt. There are many lobby groups for sugar. You know, Archer Daniels Midland, for example, is a very, very big advocate for high fructose corn syrup. The American Beverage Association, Chris pointed out the Sugar Association as well. So there are lobby groups. Among those lobby groups, the most influential in this whole beverage situation was the American Beverage Association. I hate to say it, but if you guys go to many of you are physicians, you go to a continuing medical education event, and I've been to several for internal medicine and family medicine, you find people walking around with bags that are labeled with the American Beverage Association. They come to these conferences quite often. So, okay, any additional comments?
This is Karen. I'd like to ask a question. No, you know, so we know there's a lack of public education around, you know, the dangers of food in general. I mean, it's just not out there every day in people's faces. Do you know of any studies that have taken like control groups and interventional groups, educated the families on their, you know, the health risk of sugar, and watched over time to see whether there's a decrease in consumption of sugary foods and beverages? Because I think that public education piece is so important in moving the needle on consumption of these things.
Yeah, it's an interesting point, Karen. I think most experts would probably say that education by itself won't change a lot of what people consume. However, and this is a caveat, we do know when you put the calories next to things, which they do in some restaurants, or if you teach people to read labels and to pay attention to them, that does influence what they buy. Not necessarily what they like, but what they buy. But in terms of just, hey, let's talk about the dangers of excessive sugar. That is a whole approach. A colleague of mine in Chicago does something called the Sugar Show, which shows how much sugar is in pop, and kids are blown away. Goes, oh my gosh, this is terrible. Then they go out and then they drink their usual pop. So it's important. I think the people that need to be educated the most are policy experts, people who make policy, and perhaps also, people from industry who don't prioritize this to the great extent.
I would just add very briefly, Karen, there was a very large multi-site RCT. One of the sites was here in Cleveland that had several of the components that you just mentioned. It was family focused. They removed transportation barriers to participation. It was mostly focused on reducing or stabilizing weight among adolescents, but brought in entire families. And unfortunately, the results of that trial confirmed the null hypothesis. So one of the largest, most expensive trials that included most of the elements you've mentioned was ineffective. I think on the other hand, there have been some smaller programs that have been effective. But I think I would totally concur with Goutham that oftentimes the audience needs to go a little bit upstream for these interventions.
Great, thank you, everyone. Just a quick reminder, Cardi-OH does have a webinar next week. That's a nice opportunity over the lunch hour. So March 16th, starting at noon. We have a great panel discussing the topic of race and the clinical management of cardiovascular health. There's a registration link there, or you can find it on our website, cardio.org. And then other than that, just the usual reminders, the post-clinic survey for today's session should be in your inbox. And then for those of you who are new to the Cardio-ECHO program, you'll also be receiving a second form, which we call our contact demographic form, just some basic information. This just helps us with program evaluation. Everything would be displayed in aggregate, and we do share names, emails, and practice names at the end of the clinic, just so you can stay in touch with one another and use each other as a resource. So just to let you know what that is, and that's due March 25th if you can complete that. So I know we're right at that 9 o'clock hour, so I hope everyone has a great rest of their week, and we'll see you back next Thursday.
See you next week, everyone. Take care.
Thank you.